I want to bring in Dr. Teresa Murray Amato. She is the chair of emergency medicine at Long Island Jewish Forest Hills. Dr. Amato, welcome. Thank you for being with us. As I mentioned earlier, with the single-day death toll climbing to nearly 2,600 lives lost, we know the predictions are that it will get much worse before it gets better. But what exactly should we be prepared for?
So we are seeing some, crazy numbers throughout the United States. It's really been hard. It's almost unfathomable, the numbers that we're seeing. Deaths over 2,000 per day again, 2,000 lives lost. It's just staggering. We were hopeful that we could kind of keep this in check by using the measures that we have been recommending from the beginning. And we do know in certain parts of the U.S. that is working. If we can get people to wear their mask and socially distance, we might be able to change the curve of this. But I do agree that it looks like it's probably going to get a bit worse before it gets better, because we have seen so much infectious rates, very, very high infectious rates, especially out in the West and in the South.
And Doctor, the CDC says it will now shorten the amount of time Americans need to quarantine for the coronavirus. Can you share with us the research behind this change? And do you agree with these new guidelines?
So in the beginning, we kind of thought 14 days was a bit long, but I think we were trying to be extraordinarily cautious. Again, an unknown virus up until, just even less than a year ago. So we were really, we were also a little unclear about when people had been in contact with other people with COVID. If you remember, we couldn't test as easily as we could now. And so I think for an overabundance of caution, I think rightly so, we were doing the 14 days. Although those of us in healthcare did feel that that was probably, longer than it needed to be. What we have found is that the majority of patients, well over 90%, will be showing symptoms in that 7 to 10 day period from when they've been exposed. So I agree with the CDC. I think that it's the right time now that we have some more information and data, that I think the 7 to 10 days seems very reasonable.
So which is it, 7 or 10, though? I mean, to be imminently cautious, you would want the 10, but the recommendations are 7 or 10, right?
Yes, they're giving us a little leeway. I agree. I think, we're trying to base this on science, but there's also emotion behind this. We know that. And so if you are very concerned, and especially if you have a loved one that you think is at a very high risk, I would say, why not just wait the 10 days? It's just 3 more extra days, and making sure your loved one is safe. So yes, we would have liked if we had a particular time, an exact time period. But again, we're just learning as we go a little bit. And so I think the 7 to 10 day recommendation is reasonable. And I think speak to your healthcare provider, your doctor, about which number should you really be going for.
Okay, that is very helpful. And Doctor, recently some lawmakers have been arguing that masks will not stop the virus from spreading. For example, Ohio State Representative Tim Ginter said the virus is too microscopic for masks to protect against it. How do you respond to that statement as a doctor? And does it trouble you that people in positions of authority are still arguing against masks, against the recommendations of healthcare professionals 9 months into this pandemic?
So I think it's very difficult times. There's, again, a lot of emotion behind what people are thinking, feeling, and saying. And so you have to take that into account. This is a very difficult time. People want to get back to normal. So I don't blame people for feeling that they just want to get back to what it was like before we had to walk around wearing masks. But what I can say is that we know if both parties that are speaking to each other or next to each other are wearing masks, we will greatly decrease the chance of transmission. Is it 0? Of course it's not, but it's much, much better. So it's not just the mask wearing, it's how far you are from each other, at least 6 feet, and how long you are around somebody who has COVID. So if you have a brief encounter with someone and you have your mask on and you're several feet away, it really does decrease your chance of getting the COVID virus. So we know that masks work. The regular surgical masks you can wear, or a cloth mask, is, I think, very appropriate for the public. For those of us in healthcare in the hospital, we wear the N95 mask, which is obviously will decrease the transmission even more, although it's quite uncomfortable after a few hours. But that's what we're doing in the hospitals. But I recommend everyone to wear a mask. We know the science behind it. It really does decrease the transmission.
And doctor, we just went through the Thanksgiving holiday, which was for many people a different one from years past, especially those who followed the CDC guidelines and did not travel to gather with their families. We don't realistically have much time before families will again try to gather for the holidays coming up. So what would need to happen for you to say that it's healthy and safe for people to travel to see loved ones?
So again, this is a very personal and professional issue for myself. We have a tradition of traveling on Christmas and Christmas Eve or Christmas Day. And we've had some really frank conversations with our family that we just won't be doing that this year. We don't feel that that's safe. So I'm going to go back to what we recommended during the Thanksgiving holiday. Let's make this a small, intimate event this year. Try to decrease your traveling as much as possible. Go ahead and use your iPads or your tablets to communicate with your family and loved ones. If you are going to get together, keep it small, less than 10 people. Again, if you can be outside, I know it's going to get cold, but during the Thanksgiving holiday, we put a heater outside and we spent most of our time outside as much as we could. So staying outdoors if you can, with the weather permitting, trying to limit the number of people you have. And if you're going to be inside, I would recommend you wear the mask, especially if people are coming, from outside your family. Wear a mask while you're indoors and try to increase the space between people while you're talking and interacting.
Great advice, Dr. Teresa Murray Amato. Thank you so much for joining us.
Thank you for having me. Stay safe.